Dr. Najy Masri from Oschner and the LSU Health System has been fantastic for us each week here on Monday. He's been kind enough to jump up an hour and stop in here at 7:30 on OTB. Doc, good morning. How are you?
Good morning, guys.
Always thank you for your time. If you want to start off, obviously, if with just an update since the last time we've spoken, we've seen Baton Rouge really start to get some numbers here in the East Baton Rouge Parish.
Yeah, we're about a month into this, and the first death that we saw from coronavirus nationwide was actually in King County, Washington, on February 29th, so a little over a month ago.
Wow.
Exactly a month ago, we had about 17 deaths in the United States, and now we're over 20,000 deaths. 350,000 cases, were more than 2 times any other caseload in any country. Then you look here locally in Louisiana, a month ago, we didn't even have a case. Our first case wasn't until March 9th. And now we're sitting at over 13,000 cases, almost 500 deaths. Over 50% of those cases are really in the greater New Orleans area. But like you mentioned, East Baton Rouge is now moving up to be kind of a second smaller epicenter. A lot of people you might be hearing in the media right now are talking about this peak week, and everyone's looking at these graphs with the curves, and certainly we're towards the higher end now of that curve. And whether that peak week comes this week or next week or later in the month is yet to be seen.
Doc, can you help explain to me why, or just how the timing of all this works out? Like, how do we know, and why is it that we are expecting to see a spike in Baton Rouge this week? Is it just because of more widely available testing, or is it because of how it's transmitted? Like, how is this spike coming about?
I think it's a combination, T-Bob, of both. This thing sweeps through communities. And I think because, like we talked about with Mardi Gras, it started here in New Orleans, and it's certainly just a matter of time before it sweeps into other communities. We started off, when we first started, it was just in a couple of parishes, and now it's in 61 of 64 parishes in Louisiana. So I think that's part of it. And I think the second part is what you hit on. I think now we are really in the point where we're doing more rapid, expedited testing. And so I don't think it's necessarily all that Baton Rouge is just getting started. I think that we are now in the process of truly identifying those infected people out there, whether they're in Baton Rouge or not.
Doc, where do you get your information from? Is there a trusted site that you use that the public can go to? Because I think one of the more concerning things for the public is that when you hear officials and leaders speak, there's constant diluted messages. Each message seems to be different every time.
Yeah, that's a great point, Jordy. It's all out there in the media, and the media on TV a lot of times likes to focus on the ventilators, the PPE, the different things like that. I appreciate forums like this where we can really give a true message to the listeners. I would caution them to get overwhelmed by that amount of information. I think probably some of the better sources is things like the CDC website that gives some more specific information for consumers, not just for healthcare professionals, and then forums like this.
Doc, tonight the ESPN will show the replay of Atlanta and New Orleans, the dome reopening in 2006, the special game, kind of the Sean Payton, Drew Brees era, getting back. You obviously know about it, but is there any comparison to life after Katrina or life during Katrina through this pandemic?
It's an interesting parallel. Katrina really was sudden. I think 2 nights before Katrina, I was sitting in the dome watching the Saints play. I think it was the Ravens and Hazlitt last year. And then all of a sudden we heard about this storm in the Gulf that could get worse and worse. Wow. So it came, it went, we dealt with the aftermath at that point, but there was no persistent threat that was out there. And then beyond that, we had a national, even worldwide resource pool that we could draw from. COVID-19 is a little bit different. It's this prolonged state. The threat didn't come and go. The threat is just hanging around. It's for everyone. Everyone feels that life is on hold. And on top of that, we don't have a federal resource to grab from. We don't have a worldwide resource to grab from because, unfortunately, we're pretty much the last major country that this hit. And so, look, Katrina changed the way we live locally, and COVID's going to change the way we live worldwide.
Talking to Dr. Najy Masri here on Off the Bench, 104.5, 100.3, 94.7 ESPN. Doc, a couple weeks ago, you used an excellent analogy, talking about kind of been playing that Les Miles offense. We need that more wide-open Joe Burrow-led attack against this fight, and then subsequently you saying that with the shelter-in-place order goes into effect. That's now a couple weeks ago. Are we seeing any improvement with the more aggressive approach?
We do need a game plan to beat this. Like you said, I mentioned a couple weeks ago, we were playing defense. We needed to play offense. We needed to play Joe Brady, Joe Burrow offense. And so let me give you maybe a more inquisitive breakdown, maybe a Steve Insminger game plan on how we're going to get this going. So, and a lot of the things we talked about and a lot of things we are doing, but on a state level, I've always said we needed more testing. We needed expedited testing. We need to identify those individuals that are infected and isolate them. That's starting to happen now. Louisiana actually has the second highest rate of testing per capita in the nation now.
Oh, wow.
On a national level, we need a better federal allocation of resources. That's what the TV media is hitting on, ventilators, PPEs. But not only that, we need to have this true stimulus package in effect to assist those who are affected by the isolation policies. That's starting to gain some traction. It's on the individual level here locally that I think we could use some work. We need to get to the point where we are acting as if everyone has the virus.
Mm-hmm.
No gatherings more than 10 people. If you're symptomatic, stay home or go get testing. Wash your hands as much as possible. Use hand sanitizer. Clean things with at least 60% alcohol or with bleach. One problem I've always had with the social distancing, all of us have been driving around, whether it's Baton Rouge, Alexandria, New Orleans, and we see parking lots full in front of stores. And so we don't allow gatherings more than 10 people, but we'll have 500 people in the grocery store. I left the hospital one day, and I went to a grocery store. I felt more at risk at the grocery store than I did at the hospital with the 400 or 500 people there, especially when the stay-at-home order was first implemented. Now stores are catchy route too. Different stores are putting in policies like Target and Costco and Walmart where they can only have a certain amount of people in there. I think Walmart now is 5 people for every 1,000 square feet of space, which only put them at about 20% capacity. That needed to happen. That's happening now. But we need to work together on a local, individual level and have a civic responsibility to halt the spread of this virus. And I know a lot of people get tired and they get bored of it, but you know what? Boredom is healthy. I'd rather you be bored at home than sick in the hospital.
Doc, so I'm having to make one grocery run a week, right? That's kind of how we've been planning it out, and wearing masks, gloves. Like, what is the correct protocol for everyone out there that does have to go to the store at least that maybe once a week, maybe twice or something?
Look, this is the battle between life, normalcy, and staying healthy. I think a couple of things I would suggest. One is limit your trips to the store. It doesn't have to go in groups. It can be one individual as a representative of the family to go to the store.
Yep.
I think one interesting option, and my family just recently did this the other day, is to order your groceries online. A lot of grocery stores like Rouse's and some of the ones alike, some of the apps like Waiter apps, have grocery alternatives where you can order the groceries and they can be delivered to your doorstep. You don't even have to step outside and get them. They'll go straight to your doorstep. I think those are nice options. Anything that we can do to limit your exposure to others is the way we're going to start to halt this virus.
Lasting message this week before we catch up next Monday? Anything on the way out?
Look, I think, again, the numbers are going to stagger people as we move forward. And I just want people to understand that we're going to get through this. We're going to come out on the other side of this if everybody does their part in trying to halt this virus and stay away from each other and socially isolate. There's going to be a time later for celebration. There's going to be a time later to get together. That time is not now, but it's coming.
LSU Director of Hospital Services at Oschner Medical, and with us at Oschner Medical, and with us every Monday here on OTB, Dr. Najy Masri. Thank you, sir.
Thank you. You guys stay safe.
Yes, sir.